Hi, my name is Steve Hodgson. I'm a physiotherapist and director of Harmonshire Physiotherapy in Sheffield. Today I'm going to talk about ankle injuries and look at one of the most common injuries that we see through the clinic, which is the sprained ankle. People sprain their ankle for many reasons. It doesn't necessarily have to mean you're running and jumping around, but you could just be walking on uneven ground, or you just trip off the side of a small curb or something. Whatever happens, you end up taking the ligaments in your ankle to an end of range and stretching them a little bit. And as you stretch them, depending on how much you stretch, you will damage them up to a point, and this will stretch the ligaments so that the joint itself becomes a little bit more unstable. Many people go over their ankle on a regular basis, but they don't all necessarily damage things. So as you go over your ankle, the muscles around your ankle and leg are aware of this, and they contract rapidly and then actually get the foot back in the correct position. It's only when it goes past this point does it actually become an issue, when the ligaments itself becomes stretched, and then you become you have a painful and potentially unstable ankle. Interestingly enough, there's about 18 to 30% of people who go on to have chronic ankle sprains. These are the people who keep going over it time and time again, and these are the people who sort of are the biggest challenge to physiotherapists to try and change. This problem occurs for many reasons with a chronic ankle sprain. Is that once you've damaged the ligaments, as the ankle becomes unstable, you lose awareness of where your foot is in space. When you're walking, you're unaware of how you balance. Your balance mechanisms are compromised, and then you start to find that when you twist your ankle slightly, instead of being able to correct this, you keep going over it, and this causes a repeated trauma to the ligaments, which becomes a vicious circle where you get more pain, swelling, loss of control, and then eventually you get increasing levels of disability potentially. Naturally, when you're in pain, people don't know what to do, and then they start to rest it more. And resting isn't necessarily the best thing to do with an ankle, but it's trying to get dynamic stability across the ankle joint. As well as looking at the ankle, you'd always look at the knee, the hip, and the trunk, because we know from recent research, that when you damage your ankle, you start to have compensatory changes further up the limb, which can contribute to this ongoing problem. So it's not uncommon for people who've damaged their ankle to find they've got weakness around the hip on the corresponding side. This could be the cause of it, or it could be a consequence of the ankle sprain, but whatever it is, people do end up with some weakness around the hip, and so often you'd spend time trying to rehabilitate them by actually using control around the hip as a way of actually getting better control with the leg. Other ways that you may help is a sort of dynamic control is to look at gait patterns, looking at how people move on a regular basis. It's not uncommon for people to walk with a foot turned out slightly if they've damaged their ankle, because they start to find that gives them more control. But then they lose the normal mechanisms of balance control, and then they get this ongoing problem. It still makes you vulnerable. People often complain of problems at night because when it's dark they can't use their eyes to balance, so they're using vision as a way of compensating for an unstable ankle. There are many ways of changing what you do, and a lot of this is very subtle and it's very much subconscious. We're not aware of what we're doing, but once we learn these habits, it gets very hard to change what you're doing with your ankle, unless you start to get someone to look at you and give you some sort of guidance. And this can take several weeks to change, but with practice and certain tricks you can use, you can make good improvements in terms of the ankle control. So the key, if you do get an ankle ligament injury, is to get dynamic control back through that leg and the whole of the limb that's been affected. Look to why you're getting a repeat trauma and change those patterns of movement. If you do that long term, you can make good improvements to your ankle. Thank you very much.